Now, as we were discussing with Michael Gove earlier, the UK lockdown has been extended, but several European countries are now beginning to ease their restrictions. And this week, Denmark began that process when it became the first European country to reopen primary schools and nurseries. The country, which has seen around 350 deaths from coronavirus, took the step after its Prime Minister hailed the surprising success of its own lockdown. So what, if anything, can the UK learn from this? We're joined now by the Danish ambassador to the UK, Lars Thuesen. Thank you for being on the show. Denmark has started to ease some of those restrictions. What are you doing?
Well, we lifted some of the restrictions last week. The students in primary schools, in kindergartens and nurseries are now back. And tomorrow, on Monday, we're going to lift some other restrictions. So, for example, dentists are going back to work, beauty clinics are going back, the hairdressers are going back, small businesses are opening up.
And why did you decide to ease these things before others? What is it specifically about those early restrictions that you've lifted?
Well, first of all our key indicators are pointing in the right direction. If we look at the number of people in hospital, the number of people in intensive care, the number of patients on ventilators, these numbers have been stable or have been coming down the last 2 weeks or so. So we're definitely not out of the woods yet, but we are moving in the right direction. And we can't stay in a lockdown forever. So this decision about the schools and the primary schools and the kindergartens is based on scientific advice to the government as such. Several models have been presented to the government, and this was the one which was chosen. It might sound strange, but the children in this context is not a vulnerable group, and that's probably one of the reasons why they chose to open the schools. It's also vital for our economy. If we want people to go back to work, we have to make it possible for the students to go back to the schools and the small kids to go to the nurseries and to the kindergartens.
Of course, as soon as you start to ease some restrictions, we don't know what will happen to the virus. It's very much a tentative process. If those numbers start to rise again of infections, could we see the lockdown tightening again in Denmark?
The Prime Minister has made it very clear that we'll follow it day by day. And I mean, if the numbers are pointing in the wrong directions, we'll have to impose restrictions again. So we're also telling the Danes that we are lifting some of the restrictions, but they still have to behave like they have been doing for the last month. They should keep a social distance. There shouldn't be gatherings of more than 10 people. People should still work from home. We still close our borders, etc. So we're not lifting all the restrictions. We're easing some of the restrictions, and then we'll closely follow the development during the coming days and weeks.
Do you think it helps that you are effectively giving the people in Denmark two messages here? You're saying, look, things are getting better, so we can start to ease some of the restrictions, but you have to behave responsibly. You're trusting people.
It does work. Before Easter, the Prime Minister told the Danes that it would be possible to ease some of the restrictions if they behaved during Easter time, during these wonderful summer temperatures. If they behaved responsibly, if they continued what they had done the first 3 weeks, then we would be able to open up again. So, I mean, it was sort of a pact between the government and the population.
Now, Denmark moved very quickly in the early stages of the virus. You were one of the first countries to go into quarantine. Do you think that is part of the reason why you're now able to lift some of those measures now?
Well, I'm not an expert, but I think the restrictions have worked so far. The Danes have respected the restrictions, and now finally there seems to be light at the end of the tunnel. But I also have to emphasize we're not out of the woods yet.
One of the key things that people are talking about when it comes to moving forward, getting out of the lockdown, is testing. What's Denmark's attitude been to testing, and how important is testing in the fight against COVID-19?
Testing is very important. We are testing about 5,000 people a day, but we're also going to change our strategy, because right now we are testing people with symptoms, but we're going to test a larger proportion of the population in the futures, in the days to come. And right now we are building more testing facilities in the parks of the major cities in Denmark. We don't have the details of the new strategy yet. It's a political decision that we're going to elaborate a strategy during the coming days, and then we'll open up for more testing.
And just finally, the President of the EU Commission apologised to Italy this week for not doing more to help that country at the start of the coronavirus outbreak. I mean, in big crises like these, many countries will turn to the EU for help. Do you think they should have done more?
You can always do more, and I mean it's also easy to see afterwards what you should have done. This is an unprecedented situation, and I mean the handling of the crisis was something that you had to do on the spot. I think the most important thing for any government is to look at your own citizens first, but also, of course, to look at the international cooperation as such. And we have also tried to assist Italy. We have sent ventilators to Italy. We have also sent mobile hospital as such. But of course, we could have done a lot more. But also, it's very important to emphasize that health issues as such is not the competence of the European Union or of the Commission as such. It's a national competence. But there's a lot of coordination going on in the European time for the time being, and there's a lot of financial assistance going to the affected countries.
Italy felt abandoned though, didn't they? They felt that at a time of crisis, other EU countries look to their own nations first.
Yes, they do. And I don't blame them. I mean, but also, as I said before, when you're hit by a crisis you have never experienced before, the worst crisis, worst health crisis we have ever seen, the worst crisis we have encountered since the Second World War, of course, any government is first and foremost looking at its own citizens, and then at a later stage try to open up for more international cooperation.
OK, Lars Thuesen, thank you very much for coming on the programme and explaining the situation in Denmark. Thank you.